We're starting with a story that has a lot of people saying deja vu. A cruise ship outbreak, Americans flown back to the US, quarantine units activated, and a rare virus called Hantavirus now gaining national attention. Health officials say that the risk to the public is low and that this is not another COVID situation, but after everything this country went through during the pandemic, whereas like outbreak, quarantine, and possible person to person spread are going to get people's attention. So let's walk through what's going on. This centers on a cruise ship named the MV Hondius. And that's been linked to multiple hantavirus cases. CNN reported that 122 guests and crew were evacuated. 18 passengers are now back in the U.S. and being monitored at medical units, mostly in Nebraska and 2 in Atlanta. CNN also reported that 3 passengers have died since April 11th, and several others are sick. A government chartered flight brought 17 Americans and 1 British passenger to the U.S. early Monday. Some were taken to the University of Nebraska Medical Center in Omaha and home to the federally funded National Quarantine Unit. Officials say that passengers may have been asked to self-isolate for 42 days with daily symptom checks for those staying in Nebraska. So what is hantavirus? Hantaviruses are usually carried by rodents like mice, and people typically get infected through contact with infected rodents or their urine, droppings, or saliva. Symptoms can show up 1 to 8 weeks after exposure, and they can include fever, headache, muscle aches, stomach pain, nausea, and vomiting. And in severe cases, hantavirus can progress to coughing, then shortness of breath, then the fluid in the lungs, then shock, and then death. There is no licensed specific antiviral treatment or vaccine, so care is mainly supportive with close monitoring and treating complications. So the unusual part here is, the concern about possible human-to-human spread. It's unknown exactly how contagious hantavirus is, and that's something that the federal government is tasked with telling all of us. Health and Human Services Secretary Robert Kennedy Jr. says that the CDC teams have been involved from the beginning and that they have everything under control.
We've had CDC teams on it from day one. I was speaking with the University of Nebraska since the second day of the outbreak. I was speaking with Governor Dillon of Nebraska. We had a CDC team at Tenerife. We had airplanes ready to take the patients, the 17 patients, off the vessel and transport. 2 of them went to Atlanta. One of those was symptomatic. They're in a biocontainment lab in Atlanta. The other 16 are now in Nebraska. One of them is symptomatic. He is in the biocontainment lab. The other ones are being tested and supervised and given plans for going home. We have this under control and we're not worried about it.
This
His voice sounds like the hantavirus. I wouldn't stand too close to him.
You didn't like that person-to-person contact?
Like every time he talks, it just reminds me of like a disease.
A
journey.
Now this matches what health authorities are saying to the public, that the risks remains low. But this is where the conversation gets bigger, because after COVID, Americans remember the mixed messages, the mistrust, the shortages, the politics, and the exhaustion. So yes, officials say this outbreak is contained, and yes, they say public risk is low, but bigger question is whether we're actually prepared if it's not, because the whole government that we have is kind of hard to trust. So Dex, do you think we're ready for another pandemic?
I'm always ready for another pandemic. I'm always ready. What I'm not ready though is to find out. What I am ready to know is, how did the rat droppings and pee get into your system? Like, what were y'all doing with the rats? That's what I want to know. Because that was a bit much for me.
Well, just because it could be somebody had rats in their house and
So
the
Ratatouille
rat
was in your
pooped
house.
somewhere that
Nobody
they
wanted
weren't
to lose
supposed to
with you?
poop on some food or something like that, and that's how they got
And
it.
did nobody see that?
Uh,
Nobody saw the poop on the
They
food?
might have thought it was like a little chocolate sprinkle. Them little rat turds.
So you had your spaghetti and meatballs, and you're like, this must just be a different little Italian seasoning, and you ate it. Something ain't right about this.
It's very possible that that's what happened. Do you think this can end up being worse than COVID? I mean, we already are in an inflation, an
I'll put it
economic
this way.
crisis.
I think that it could and probably will be worse than COVID, but we'll never know it, because guess what? If you don't get tested, you don't have it. That's the motto of our president. So like you see voice over there is saying like, this is contained. We don't have anything to worry about. And as long as he's saying that and Donald Trump's sitting there not even paying attention to what he's saying, we're fine. We won't have no issues at all.
I mean, it's sad to say, but you're probably right.
I think if news media weren't putting this information out, we wouldn't even get this information. They wouldn't tell us about this.
No, if we weren't doing the show,
Yeah, they would not tell us about this at all.
And that's sad to say. Did you see your president talking about anything anyone that says that we're militarily competing with Iran, or Iran's in a militarily good spot, that we're committing treason? So you better be careful what you say, Dex.
He said that?
That's what he said. Yeah, he said today. So we might be committing treason next time we talk about what's going on.
Hey, okay.